Welcome to the Permanent Pacemaker Implantation Tutorial video series. I am Dr. Gervacio and I head the Asia-Pacific Heart Rhythm Society Committee on Implantable Electronic Devices. This project is a joint project of the APHRS, the Philippine General Hospital, the Pusong Pinoy Foundation, and Abbott. It will be presented in two formats. The first is by chapter presentation, where one can easily access the individual steps involved in pacemaker implantation, while the second format will be a full-length presentation highlighting individual implantation styles of Drs. Michael Joseph Agbayani, Urdi Fadragilan, and yours truly. We hope you learn a lot from this video tutorial series. Do sit back and enjoy the videos. Permanent pacemaker implantation is a highly effective, highly proven standard of care treatment for symptomatic bradycardia. The implantation process is deceptively simple. One must come prepared to the implantation to ensure a highly successful procedure and to avoid complications. The patient is brought to the cath lab in a post-absorptive state, typically requiring 8 hours of fasting. The patient should come mentally and physically prepared for the procedure. A pre-procedure chlorhexidine scrub is typically prescribed as part of infection prophylaxis, along with the use of prophylactic antibiotics covering for Staphylococcus and Streptococcus. With the patient on the table, the following points need to be assessed. First, hemodynamic stability. Every effort must be made to ensure that the patient remains stable throughout the procedure. Second, the need for temporary pacing. There are two options. Either a transcutaneous pacer may be used, which is non-invasive but painful. Preferable is the use of transvenous temporary pacemakers to ensure hemodynamic stability and a smooth procedure. All materials need to be prepared and ready for the implantation. And finally, the need for conscious sedation must be evaluated and delivered at this time. Proper antisepsis is key to preventing infection. Chlorhexidine scrub is delivered in several layers, covering a wide area ranging from the nipple to the ears. The prep is delivered in a centrifugal fashion, starting from the area of the incision. Both sides need to be prepared to allow flexibility in the side of implantation. An iodinized adhesive film is applied firmly to both sides of the chest, ensuring that the field is less likely to be contaminated from factors such as the patient's breath. Care must be exercised to ensure that the film is firmly and flatly applied to the entire chest wall of the patient. A standard surgical drape is used to cover the patient from head to feet. Once this is applied, both sides should be open to allow access anytime during the procedure. Essential surgical instruments include medicine ball, long forceps, retractors, Mayo scissors, curved mosquitoes, a mixer, and a needle holder. Electrocautery is readied. Care must be taken to apply the grounding patch of the cautery before draping the patient. The image intensifier is covered. The team comes in after a 6-minute scrub, gowns up, takes care in putting on the gloves, and gets ready for the procedure.